And with us now is Dr. Leah Devlin. She's the co-chair of the NC COVID-19 Vaccine Advisory Committee. Dr. Devlin, thanks for joining us.
Thank you, David. Good to be here.
So we're seeing more and more of these vaccination clinics across our state. How effective are these types of events?
Well, first, David, let me say that one of the biggest challenges is to have enough vaccine available to have a mass vaccination clinic. So that's one limiting factor. But these are great strategies. They simplify the communications, where to go, how to get your vaccine, get in line. They're logistically move you through pretty quickly so they can do a lot of vaccines in a short amount of time. And that makes it look easy, but there's a lot of planning that goes into this. But it's a great strategy, and we'll see more of these as more vaccines become available.
And with the vaccine supply, it's still far outpacing demand. What's causing the shortage?
So the shortages are actually on the manufacturing end, and our manufacturers are doing all that they can to produce as much vaccine as they can. We hope to see more vaccines coming into all of the states in the coming weeks and months as new vaccines are approved. We have the J&J vaccine and perhaps AstraZeneca and Novavax coming online after that. We have new contracts with Pfizer and Moderna, which are already being used. So more vaccine is on the way, so that's really good news.
And with the Johnson & Johnson vaccine, the FDA has a meeting next week to discuss that. How much will having another vaccine on the market help with some of these supply issues?
So every new vaccine that comes online is going to be enormously helpful. We're doing a great job in North Carolina in terms of immunizing the population with the doses we have. We've gotten out 100% of the first dose and around 83% of those second doses. So once we have it in this state, we know how to use it. We have the capacity to use it. The health departments, the primary care centers, the hospitals, other partners, the retail, the Walgreens program, the long-term care program. We're really doing a great job in our state. We're just simply limited by the amount of vaccine that we have.
And so North Carolina is working through its priority groups. Phase 3 begins next week. When do you think the vaccine will be available to the general public?
Well, you raise a good point, David. We do have 5 phases that we're following, 5 groups in North Carolina, and we need to really focus on moving our population through as quickly as we can. And we are hopeful that by spring we'll be moving into some of the other groups that are having to wait right now. We know that in March we're going to be opening up into Group 3. Teachers will already be eligible by the end of February, I think February 24th. So we're moving through those groups. We should have a fair amount of vaccine by late spring, and certainly by the end of July. We hope that we have as many vaccines for people that are eligible and want to get them. And it's really, really critically important that we move as quickly as possible through our population. And I want to really add, too, that we have a really strong focus in North Carolina on reaching the historically marginalized or underserved populations. That's a real challenge and a very important one that we take very seriously. I believe we're reaching about 18% of minority populations now in our state. We need to do better. And some of the innovative strategies that will be put in place to go into community to take vaccine into populations where they live, work, play, and pray will be coming online as more vaccines are available in the state as well.
And real briefly, Doctor, what do we know about how these vaccines react to some of the variants that we're seeing?
Well, so far with Pfizer and Moderna, very protective against the British variant. Moderna a little less so with the South African, but both of those and the J&J vaccine do protect against serious illness, hospitalization, and death, and that's what you're really after. So we believe that we can continue to address these variants with the vaccines that we have.
Dr. Devlin, thanks for your time and your insight. We appreciate it.
Thank you.